The following segment is sponsored by Springfield Clinic.
Joining us this Wellness Wednesday is Dr. Sean O'Malley, a board-certified general surgeon with an emphasis on breast surgery in his practice, and Amy Mann, a nurse practitioner specializing in breast health with the Springfield Clinic General Surgery Department. Breast cancer is our topic today. It is Breast Cancer Awareness Month. We want to talk a little bit about kind of all of the steps in the process. So, Doctor, we'll start with you. You're telling us, what can someone maybe expect right after that initial diagnosis?
Yeah, so getting diagnosed with breast cancer can be a really stressful, emotional situation, and our team tries to get involved right away by contacting the patient with their biopsy results, and then we immediately get them connected with their care team. We try to take a multidisciplinary approach to breast cancer, so that means meeting with surgery, medical oncology, potentially radiation oncology, and plastic and reconstructive surgery as well. And the key is this multidisciplinary approach. Our team meets weekly to discuss each patient, and we come up with a customized treatment plan that follows national guidelines and tries to take good care of them.
Now, is that something that has changed over the course of the last couple of years, 20 years ago versus now, like that maybe that customized care?
Absolutely. So every patient has different risk factors, family history, personal history, and it all plays into the best approach for them.
Yeah, and Amy, talk a little bit about people out there, for women and men. Breast cancer is a serious issue. Maybe some of the people who maybe need to start thinking about coming in and getting tested. How could they know that I'm in that category?
Well, for women especially, you're generally at a higher risk if you have a family history of breast cancer, especially multiple family members with breast or ovarian cancer at younger ages. Also, if you have dense breast tissue on mammogram or extremely dense breast tissue, or personal history of breast biopsies, even some benign breast biopsies, if they have atypical cells in the biopsy, you can be an increased risk of breast cancer.
Yeah, and after they get treatment from Dr. O'Malley and his team, you focus a lot on like that post-care, right? So tell us a little bit about what that journey looks like for men and women, so after the initial surgeries or treatment, whatever it might be.
Yeah, at Springfield Clinic, we do a really great job having that team environment during your treatment, but we try to have as robust of a survivorship program for those survivors. So I see survivors annually for clinical breast exam. I coordinate their post-treatment imaging, and we just have conversations. Tell me how you're doing. What are you struggling with? How can I help you? There are so many resources in our community for breast cancer survivors, and I just try to really assess what their needs are and how I can best hook them up with the resources to get them what they need. We also just have conversations about their family members, because almost every breast cancer survivor has a sister or niece or daughter or granddaughter that now has a family history of breast cancer.
Yeah.
So we have prevention conversations even in a survivorship visit.
Yeah, talk about taking care of the mental health aspect of a breast cancer survivor.
Yes.
Doctor, for anyone out there who's watching, who wants more information, or they maybe want to start having these conversations, and they can be difficult ones with the doctor, where can they find all that information?
Absolutely. I would say the #1 resource is reaching out to your primary care provider. It can be a huge resource in starting this process, and you can always give us a call. At the Springfield Clinic, we have a great website too that kind of walks people through the different options.
We really appreciate the time this morning. Thank you so much.
Thanks for having us.
Thank you for watching. Make sure you subscribe to our YouTube channel and be sure to watch more videos from Fox, Illinois.